Your heart is truly remarkable. The engine of your life, beating tirelessly from the moment you're born, keeping you alive and active through every season of your life. Most of the time, it works silently in the background. And because it does, it's easy to forget how much it does for you each day. But as we age, it becomes increasingly important to pay attention to this vital organ and the many ways our choices, especially around medications, can influence its health. I'm Dr. Michael Kent, a cardiac surgeon with over 20 years of experience. And in my career, I've observed countless cases where everyday medications, taken with the best intentions, interact with our bodies in ways we might not fully understand. While medications play a crucial role in managing pain, inflammation, mood, or digestive issues, knowing how they interact with the heart allows us to use them more safely. The good news is that with awareness, open communication with healthcare providers, and thoughtful lifestyle habits, we can continue to enjoy medications responsibly while supporting long-term heart health. Today, I want to share insights about common medications and supplements, what to consider as we age, and steps you can take to care for your heart in a holistic way. Understanding common pain relievers. NSAIDs. Pain is a universal part of life. Whether it's a headache, sore joints from arthritis, or an achy back after a long day. Non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen, naproxen, and diclofenac, have become the go-to solution for millions of people worldwide. They reduce inflammation, ease discomfort, and often work quickly, which is why they're so widely used. Many people keep them on hand at home and take them as needed, sometimes without much thought. For the majority of healthy adults, occasional NSAID use is considered safe. But as we get older, it's helpful to be mindful of how our bodies respond. Our cardiovascular system changes with age, and the way our bodies manage fluids, blood pressure, and circulation may be more sensitive. NSAIDs can influence fluid retention and blood pressure, which is something to consider if you already have hypertension or other heart-related concerns. That doesn't mean you should avoid them entirely. Rather, it's wise to discuss dosing, timing, and duration with a healthcare professional. Alternatives are often available. Acetaminophen can be effective for mild pain and is generally easier on the cardiovascular system. Topical creams or gels can target inflammation locally without affecting the entire body. Physical therapy, gentle stretching, and low-impact exercises like swimming or yoga can also reduce pain and stiffness naturally over time. The guiding principle is moderation, using the lowest effective dose for the shortest duration necessary, and always checking with your physician if you're taking NSAIDs regularly. Stomach medications. Proton pump inhibitors. Proton pump inhibitors, or PPIs, such as omeprazole, pantoprazole, and lansoprazole, are some of the most frequently prescribed medications in the world. They're designed to reduce stomach acid, which helps manage acid reflux, heartburn, and protects the stomach lining when taking certain medications. For many, these drugs bring relief and allow for a more comfortable, symptom-free life. Like all medications, PPIs are most effective when used appropriately and with guidance. Long-term use can influence how nutrients are absorbed, particularly magnesium, which is essential for normal heart rhythm and overall muscle function. Ensuring that you're taking PPIs as directed and periodically reviewing the need for continued use with a physician can help you reap the benefits while minimizing potential concerns. Sometimes, lifestyle adjustments can reduce the reliance on long-term medication. Simple changes like modifying your diet, adjusting meal times, avoiding late-night snacks, and managing body weight can make a meaningful difference in reflux symptoms. Incorporating these habits in combination with short-term PPI therapy can help maintain comfort while supporting heart and overall health. Regular monitoring of nutrient levels, when necessary, is an excellent strategy for proactive care. Cold remedies, Oral decongestants. When cold and allergy season arrives, many of us reach for quick relief. Oral decongestants, such as pseudoephedrine or phenylephrine, are commonly used to ease nasal congestion, making it easier to breathe and sleep comfortably. These medications are effective because they constrict blood vessels, reducing swelling in the nasal passages. This localized effect is very helpful for symptoms like a stuffy nose, sinus pressure, or mild sinus headaches. However, it's important to understand that these medications don't only work in your nose, they circulate throughout the body. Because they constrict blood vessels systemically, they can temporarily increase heart rate and blood pressure. For most healthy adults, this is usually not a concern. But for older adults, or anyone with cardiovascular conditions, high blood pressure, or a sensitive heart, this effect can be more significant. It's not about avoiding them completely. It's about using them thoughtfully and safely. Fortunately, alternatives exist that act locally and provide relief without impacting the cardiovascular system. Saline nasal sprays, for instance, can gently flush and moisturize nasal passages, helping reduce congestion naturally. Humidifiers add moisture to the air, preventing the nasal lining from drying out and becoming irritated. Nasal steroid sprays can also reduce inflammation in the nose directly, working effectively over time without affecting the rest of the body. Even simple actions like staying well hydrated, elevating your head while sleeping, and inhaling warm steam can make a meaningful difference in comfort levels. By choosing targeted solutions, you can address congestion while minimizing unnecessary stress on your heart. Understanding how a common cold remedy interacts with your body allows you to make choices that relieve symptoms while supporting overall cardiovascular wellness. Older antidepressants, tricyclics. Depression, chronic pain, and neuropathic conditions are realities many people face, particularly as we age. Tricyclic antidepressants, including medications like amitriptyline and imipramine, were once the standard treatment for depression and continue to be used for certain conditions today. While these medications can be effective, it's important for older adults to consider their potential impacts on heart health. Tricyclics can influence heart rate, blood pressure, and the electrical conduction system of the heart. This doesn't mean these medications are inherently unsafe, but it does emphasize the need for regular review by a healthcare provider. For older adults, safer alternatives are often available. Modern antidepressants or certain pain management strategies tend to have fewer cardiovascular effects while maintaining efficacy for mood and pain relief. Regular check-ins with a healthcare provider are key. These appointments allow adjustments in dosing, monitoring of heart rate or blood pressure, and consideration of whether an alternative medication might provide similar benefits with fewer potential complications. Mental health is a critical component of overall well-being, and the goal is to treat mood or pain effectively without placing unnecessary stress on the heart. Open communication ensures that both your mental and cardiovascular health are supported. Understanding why a medication is prescribed, what alternatives exist, and how your body responds helps you feel confident and empowered in your care decisions. Calcium supplement. Calcium is essential for strong bones, helping maintain mobility and reduce the risk of fractures, particularly in postmenopausal women and older adults. Many people take calcium supplements to meet their daily requirements. While these supplements can play an important role, research indicates that calcium obtained through dietary sources, such as dairy products, leafy greens, nuts, and fortified foods, is absorbed more efficiently than high-dose supplements. Supplements may still be necessary, depending on your individual needs, diet, and health history. If you do require supplementation, it's important to do so thoughtfully and under the guidance of a healthcare provider. A doctor can help determine the appropriate dose based on bone density tests, dietary intake, and other health considerations. Balancing calcium intake through food, along with supplementation if needed, ensures that your bones receive the support they require without overburdening the body. Dietary calcium provides additional nutrients, and is absorbed more gradually, allowing the body to use it effectively. This balanced approach supports both skeletal and cardiovascular health, helping you stay strong and active without creating unnecessary strain on your system. The key is moderation and monitoring. Calcium supplements are a tool, not a replacement for a nutrient-rich diet. With guidance from your healthcare team, you can make choices that optimize bone health while maintaining overall well-being. Taking control. Conversations with your doctor. One of the most empowering steps you can take for your health is cultivating open, honest communication with your physician. Bring a complete list of every medication, supplement, and over-the-counter product you use to each appointment. This allows your doctor to assess potential interactions, evaluate appropriateness, and provide tailored guidance based on your age, lifestyle, and overall health. Ask thoughtful questions. Is this medication still the best option for me? Are there safer alternatives? Should we monitor specific tests, like blood pressure or nutrient levels? These discussions help ensure that each medication or supplement supports your health goals without unintended consequences. Being informed transforms you from a passive patient into an active partner in your healthcare journey. Healthcare providers appreciate when patients are engaged, asking questions, and providing detailed information about their routines. This collaboration makes it easier to adjust dosages, swap medications for safer alternatives, or implement monitoring strategies that keep your heart and overall health in balance. Proactive communication also helps prevent small issues from becoming larger complications, ensuring that medications remain tools that enhance life rather than create challenges. Lifestyle considerations. Supporting your heart naturally. While medications and supplements are valuable, they are just one piece of the heart health puzzle. Lifestyle choices play an equally important role in maintaining cardiovascular function and overall well-being. Small, consistent habits can have profound effects on heart health, energy levels, and quality of life. Regular physical activity is one of the most powerful ways to support cardiovascular health. Activities such as walking, swimming, cycling, yoga, and even gardening improve circulation, strengthen muscles, enhance balance, and support mood. These exercises also help manage weight, blood pressure, and cholesterol levels, all factors that influence heart health. Nutrition is another cornerstone of heart wellness. A balanced diet rich in vegetables, fruits, lean proteins, whole grains, and healthy fats can provide essential nutrients while promoting vascular health. Reducing excessive salt intake helps manage blood pressure, while staying hydrated supports proper circulation and organ function. Stress management is equally important. Chronic stress can affect heart rate, blood pressure, and overall well-being. Incorporating relaxation techniques, mindfulness practices, meditation, or even simple deep breathing exercises can help regulate stress and protect your cardiovascular system. Adequate sleep is also crucial. It allows your body to recover, regulate hormones, and maintain energy for daily activities. When lifestyle habits are combined with thoughtful medication management, they create a comprehensive approach to heart health. You're not relying on a single intervention. You're nurturing your body with multiple layers of support that work together harmoniously. Empowerment and awareness. Knowledge is one of the most powerful tools in health management. Understanding how medications, supplements, and lifestyle choices interact with your heart gives you confidence in your decisions. It allows you to make adjustments proactively and engage meaningfully with your healthcare team. This isn't about avoiding medications entirely or living in fear of minor side effects. It's about using medications wisely, integrating them safely with lifestyle habits, and being attentive to your body's responses. By taking an active role, you maintain energy, independence, and peace of mind, while reducing the risk of complications. Every informed choice, whether it's adjusting a supplement, choosing an alternative pain reliever, or implementing a dietary change adds a layer of protection for your heart. Awareness encourages consistency, and consistency drives long-term health benefits. Real-life stories. Seeing the impact. Over the years, I've observed countless patients who achieved meaningful improvements by combining knowledge, communication, and small lifestyle adjustments. One woman with mild arthritis discovered that incorporating targeted physical therapy exercises and using topical treatments helped relieve pain while reducing the need for systemic medications. She maintained mobility and comfort without overtaxing her heart. Another patient who struggled with chronic acid reflux managed symptoms effectively by combining short-term PPI therapy with dietary adjustments and lifestyle modifications. Over time, she became less reliant on medication while maintaining comfort and supporting her overall well-being. These real-life stories underscore a vital point. Small, thoughtful changes, guided by awareness and professional advice, can create long-lasting benefits. Every adjustment, whether it's a change in medication, a new exercise routine, or improved dietary habits, compounds over time, enhancing both heart health and overall quality of life. Practical steps you can take today. You don't have to make drastic changes all at once. Here are practical strategies to support heart health and make thoughtful choices about medications and supplements. 1. Review your medications and supplements with your doctor to ensure they're appropriate for your age and health history. 2. Ask about alternatives if you're using any long-term medications, including over-the-counter remedies. 3. Discuss monitoring strategies, such as blood pressure checks, nutrient level assessments, or heart rhythm monitoring if needed. 4. Explore lifestyle adjustments to manage pain, reflux, or bone health naturally, including exercise, diet, hydration, and stress reduction. 5. Maintain an active dialogue with your healthcare team, asking questions, sharing observations, and staying informed about new options or changes in your health. By taking these steps, you become an active participant in your healthcare journey. You're no longer relying solely on routine prescriptions. You're making informed decisions that balance benefit, safety, and lifestyle. Final thoughts. Caring for your heart every day. Your heart is central to everything you do. Giving it thoughtful attention and consistent care pays off in energy, vitality, and quality of life. Staying informed, maintaining open communication with your physician, and embracing healthy habits are all part of a comprehensive heart care strategy. Medications, when used responsibly, are tools that enhance life. Lifestyle practices, physical activity, nutrition, stress management, and adequate rest strengthen the foundation on which your heart thrives. Together, these approaches help you maintain independence, vitality, and confidence at every stage of life. Protecting your heart is an investment. By understanding your body, engaging in dialogue with healthcare professionals, and taking consistent, thoughtful action, you can ensure that your heart continues to support you reliably, allowing you to live fully and confidently. Conclusion. Your heart, your partner. Every choice, what you eat, how active you are, and how you use medications, affects your heart. Treating your heart as a partner, rather than an automatic mechanism, empowers you to make decisions that support longevity and vitality. The goal isn't fear or restriction. It's awareness, empowerment, and thoughtful self-care. With knowledge, ongoing dialogue with healthcare providers, and consistent healthy habits, you can maintain a heart that works as diligently as you do. Every step you take in caring for your heart is an investment in longevity, vitality, and a life well lived.